My name is Bea. I work here with Dr. Dadvand. We have a lot of inquiries regarding female to male top surgery, so I'm just going to ask Dr. Dadvand a couple of common questions that we receive. Is there a minimum age requirement to female to male surgery?
So there's not really a minimum age for the surgery. However, if you are under 18, you do need a guardian or parental consent. There are those certain requirements to undergo the surgery for transitioning patients, and that is being under the active care of a therapist, actually transitioning in one way or another for a set period of time. But age is not one of those minimum requirements. I've done this surgery on patients who are in their teens, under 18, and of course in those cases they had the consent of their legal guardians.
Okay. Second question, is there any pre-treatment before surgery, example, hormones?
So that's an excellent question. So for female to male top surgery, I don't require patients to be on testosterone. I would say probably about 75% of my patients are on testosterone for any period of time prior to surgery, but it's not a requirement. Now the benefits of testosterone are that it will make the pectoralis muscle a little bit thicker, and it'll also make the breast tissue a bit smaller. So it'll lend itself to having potentially a more masculine or muscular chest afterwards. However, the benefits really with testosterone are with the other characteristics of being on it, such as a deepening voice and facial and body hair. So I don't require testosterone for this surgery prior to the operation.
Okay. Third question, what is the recovery like for these surgeries?
So again, that's a really common question, and the way I look at recovery, there's different types of recovery. So number one, how long before you can go back to work or school? Some of it depends on this exact surgery type, but on average, most patients take up to about a week off from work and then they go back to work. Now, if they do something that's really physically demanding work-wise, then they got to take a little bit longer time before they can get back to work. Now, that being said, it's not a painful operation. Most patients are off pain medications after a couple of days, but it is really more letting everything heal in that first few weeks that is crucial. Now, the other part of recovery is getting back to physical activity and exercising. Again, my minimum is usually around 5-6 weeks, upwards of 8 weeks if I'm doing a double incision surgery. I like these patients to really take a little bit extra time before doing a lot of strenuous upper body exercise because it helps the scars heal that much better.
Okay, awesome. Fourth question, is there any reason someone would not be a candidate for this surgery?
Obviously, every surgery that's being done has to be done safely. So patients who, for whatever reason, have medical conditions that may deem it unsafe to undergo anesthesia would not be necessarily a great candidate for this surgery. The other type of patient is one who is not really sure where they are with what they want to accomplish. I'm really clear with patients as far as this is not a breast reduction surgery, this is chest masculinization. And I've had some patients who are not transitioning, they're cis female patients, and it's not really exactly clear whether they just want a really significant breast reduction or top surgery. And so that really the onus comes on me to define that with them and make sure that they're getting the right surgery so they don't have the regret of having a breast reduction when really in fact they wanted chest masculinization.
Fourth question, is there any other procedures that complement top surgery?
So yeah, it's a great question. I think one of the things is that really top surgery in and of itself is not the differentiation between a male and a female silhouette. So one of the common things that I do is, and can be done at the same time as well, is liposuctioning of the abdomen and especially the waist and the love handles or the flanks and the outer thighs. These are all in an effort to get a more streamlined masculine silhouette as opposed to more curvy female silhouette. And that can be done to different degrees. I've done cases where I'm doing vasal liposuction of the flanks and the abdomen just to give a smoother, straighter contour. And I'm doing some cases where I'm doing what's called vasal high definition liposuction, where I'm actually revealing the person's musculature. And those cases are very dependent on what the starting position is of the patient, but there are a lot of options and they can be combined with top surgery as well.
Okay. So last question, what advice would you give to someone going through the transition?
So I see these patients all the time in consultation. I'd have to say they're by far the most educated patient population. They've all done a lot of research, and rarely am I telling them what the surgical option is and then not knowing that that was the option. Most of these patients who come in already have an idea of what type of top surgery that they require, and they're just trying to get a confirmation from the surgeon and also making sure that they get along with the surgeon and it's a good vibe. For me personally, I think we're doing it on patients that are really not at the beginning of their transition. This is towards the middle to end of their transition, as far as they've been in therapy, they've been living the life of their transitioning gender. And that doesn't necessarily mean that legally changing their names and such, but the plastic surgery part of it shouldn't be at the beginning of the patient's transition journey. It should be more towards the middle to the end. But for me, it's one of the most, I would say it's actually the most satisfying surgeries that I do, because in a certain way, to be able to play the smallest role to change the trajectory of these patients' lives, to finally get them to see on the outside how they've always felt on the inside, it's really a priceless thing. But I would say that the one thing that I'm always cautious about choosing the patients I operate on is I want to make sure that where they are on the spectrum of transitioning, that we're not operating on them right at the beginning, but more once they've gotten the other things in place. So thanks guys for watching this video. If you have any questions that you'd want me to address in future videos, please put them in the comments below and I'd be happy to answer them. And again, thank you very much.
Also, follow us on IG at DadvandMD, DADVANDMD. Thank you guys for watching.